how to get honors in your third year clerkships. First off, definitely take these tips with a grain of salt and be adaptable, because there is a ton of variability in institutions and in finding what works best for you. My first tip is to ask for expectations and ask for feedback. When I was told to do this initially, I didn't really understand the importance of it until later on in the year. It seemed so forced and unnatural to ask for feedback, and I just wasn't really comfortable doing it. But, like I mentioned in my previous video, subjective evaluations are incredibly vague and confusing. The only way to make it at least a little bit clearer and more objective is by asking at the very beginning of every rotation, what do you typically expect of medical students on this rotation? By figuring out what the expectation of you is early on, you not only show that you value your resident and attending's direction and guidance, but you also establish a clear goal to achieve, which, if done well, means you also have a set goal to surpass in order to try and get honors. The next most important thing to ask is for feedback. Whenever you are with an attending, you absolutely have to ask for feedback midway through your time with them and at the very end. So, if you're with an attending for 1 week, you should ask for expectations on Monday, then ask for feedback on Wednesday, and then on Friday. If you're with them for 2 weeks, ask for feedback on Friday of the first week, and then on Friday of the second week. The easiest way to ask for feedback is when things are a little bit more quiet, to just pull them aside and ask, "Hey, Dr. So-and-so, I was wondering if I could ask you for feedback or if there's anything you think I can improve on." A lot of times, people won't give you very good feedback. They'll just say you're doing a great job and keep up the good work or whatever. But it's still super important to do this step, especially because sometimes you actually do get incredibly valuable advice for places that you can improve on. If they're a little hesitant to give you things to improve on, you can even consider pushing them a tiny bit more. For example, you could say, "Thank you," and then simply repeat, "What do you think I could improve on?" Like I said, asking for feedback is a gold mine for getting honors, even if they don't give you good constructive advice, because it shows that you are willing to seek their opinion, you are humble, driven, and motivated to learn. These are all qualities that increase your chance of getting honors evals. If they do give you constructive advice, then not only does that help you for all of your future rotations, it also gives you clear-cut goals which you can again surpass. And if you surpass the goal that they set for you, the attending should have no choice but to give you honors. So again, ask for expectations at the start of every rotation, and then ask for feedback midway and at the end of every rotation as well. Okay, moving on, but before I do so, I really just have to say that doing well in rotations is really all about reading the room and adjusting quickly. It can feel like a big advantage to extroverts and a big disadvantage if you're a more quiet, introverted person. But as someone who's more on the quiet side myself in these kinds of situations, I can tell you that no matter what your personality type is, you can do great as long as you are humble and you go in with the right attitude. Having the right attitude and mindset makes all the difference. Constantly be checking yourself and reading the room to check if you're overstepping your role too much. And remember, you can always ask the residents for feedback if you aren't sure. They will absolutely appreciate the gesture and be glad that you asked. My next tip is to always be listening and trying to figure out ways to help out your residents. On rounds, you should always be writing down tasks that come up, especially for your patients, but for the rest of the patients on the team too. That way, after rounds, you can go up to your resident and say specifically, "Hey, would it be helpful if I called the social worker about X? Or would it be helpful if I did XYZ task?" Instead of just saying, "What can I help with?" You'll quickly learn that just asking, "What can I help with?" is actually code for, "Can I go home now?" So it's not really the most useful thing, unless you're trying to go home, obviously. It's always a lot more helpful to the residents when you offer something specific to do, rather than ask them to find something for you to do. One thing you need to be careful about, though, again going back to reading the room, is that you should never do any tasks for your fellow medical students' patients unless explicitly asked to. If you do this, you would definitely be overstepping your boundaries and come across as a gunner and not a team player at all. Another time you should always be on the lookout for how you can help your residents is when they get ready to do procedures. You should always be watching closely because you'll see they go through the same process every time. For example, when my residents used to take me to ultrasound a patient together, I would always get the gel ready for them, I would get paper towels to wipe the patient clean, I would wipe the ultrasound probe down, and I would take the machine and plug it back into the outlet when we were done. I would also try to learn what buttons they used most frequently on the machine, so if they needed to increase or decrease the depth or something, I would be ready and able to assist them without them having to come all the way over to do it themselves. In general, I would also even do really menial stuff like opening the trash can when my residents needed to throw something away. Or, and this is another example I'll cover in a later video, but you can always find ways to help out in the OR, like grabbing a stool for your resident, getting blankets for your patient, or helping the patient get onto the table, etc. It can seem like this sort of stuff is really just busy scut work and really doesn't do anything, but I never felt like I was above it because it helped the team out, it sped up the process for the patient, and residents love it when you are constantly trying to find ways to be helpful. And they'll reward you with good evaluations, so in my mind, it makes it definitely worth it. Finally, another thing you're going to notice a lot on your rotations is that a lot of times residents will ask each other a clinical question, no one will know the answer, and then everyone will just go on with their day because they're too busy to look up the answer. This is a perfect opportunity for you because as the medical student, you often will have a lot of free time and the ability to look this stuff up. This is the kind of stuff that you should be doing without even getting prompted to do so. In general, being proactive and doing stuff even before you're asked to do so is what will help make you look like a rock star on your rotations. For example, on my OBGYN rotation, the residents were asking about the probability that a patient with placenta previa would have to come in for an emergency C-section if they just simply discharged her right now. I quickly opened up PubMed and was able to find a few articles, and about an hour later when my residents weren't as busy, I had it printed out and I just talked about the paper a little bit, and they really appreciated the gesture. This was later brought up on one of my evaluations at the end of the rotation. Doing simple stuff like that will get you honors, seriously. But again, you have to read the room and don't go overboard. You don't want to be the annoying medical student bringing in a paper every single day, trying to show off and one-up your classmate, who will definitely resent you too if you do this. So you do this when it's appropriate, necessary, and when it's useful, when it's being useful for the team, not just for the sake of doing it. Now, let's go over some quick do's and don'ts for getting honors in your rotations, especially in regards to the most common mistakes that you'll see medical students making. Don't pull out your phone on rounds. I see this happen way more often than you'd expect, and it seems like it would be common sense not to do it. But sometimes people think, oh, I'm looking up something clinical, so this should be okay, right? Well, even if you are pulling out your phone to look something up, the optics of it looks terrible. So unless the attending directly asks you to look something up on the internet, don't pull out your phone ever. Do give credit where credit is due. If your resident helps you out and you end up answering a PIMP question correctly because of it, and the attending is surprised, give your resident a shout out. It makes your resident happy, so they'll be more likely to give you a good evaluation, and it makes you look like a team player to your attending. Some residents will tell you, oh, don't give me credit if I help you get the answer correctly, but honestly, I think it makes sense to always give credit where credit is due. If your fellow med student helps you out with a task, or they helped out the team in some way, you should give them a shout out too if it comes up later in conversation. Everyone will like you more if you do stuff like this, and it makes a way better team environment in general. Don't be a gunner. One of the most common ways that gunners present is by pimping other students, or correcting them about the other student's patients. Never pimp your fellow students, or even your residents for that matter, especially in front of the attending. Don't answer questions directed to anybody else unless you are directly asked. Sometimes you'll know the answer and you'll really want to answer, but it makes the other person look bad if you just jump in and answer the question for them. Again, don't try and take over the tasks for your other students' patients. All of these things don't make you look smart or harder working than the other person. It just makes you look like a bad team player and frankly, an asshole. Do get out of a seat or off of a computer if someone needs it. It's hierarchical, but it's how the hospital works. And when you're the med student, you are expected to give up your seat quickly and without question. So just do it quickly and it won't be awkward. On that same note, don't be the only person sitting when anyone else on the team is still standing. If everyone else is sitting, then it's okay to sit. Again, this has to do with optics. So all of the following are just more kind of optics sorts of issues that, even if they're not that big of a deal, the way it looks to people is bad and will give you a higher chance of getting a poor evaluation. So don't disappear randomly. A lot of med students kind of do this, and I don't really understand why, but you should really be sticking with your team almost all the time. Let them know if you are going to go somewhere else briefly, and then when you're going to come back. Don't bring coffee on rounds. I know that some of you probably feel like you need it, but you don't want to be the one person on rounds holding coffee because it makes you look too casual and laid back. Remember that rounds is your time to impress the attending, so you don't want that casual look going on. Plus, everyone else will be silently frustrated that they couldn't be drinking a coffee also. So on my surgery rotation, I had one fellow medical student who would come 5 minutes late to rounds every day, and he'd arrive with a full breakfast tray. And this was on surgery, on the trauma service. He ended up getting chewed out for it a few weeks later and ended up doing fine because he was humble and really apologetic about it and actually didn't know how bad the optics of that was. But it would really just be the best if you could just completely avoid that situation altogether. So don't bring coffee, don't bring food, don't bring snacks onto your rounds. Another don't, but it kind of goes on the same note as previously, but don't ever complain about being tired, either to your friends or to anyone on your team. There is always someone more tired than you, and I can't tell you how annoying it is when somebody says they're tired. One time I was doing a 24-hour overnight shift when I was on surgery, and my friend on Family Med messaged our group chat complaining about how he had to work until noon and was so exhausted and hated Family Med. And it was just really irritating. Remember, the residents are working even longer hours than any medical students could ever possibly be working. So there's absolutely no place to complain about being tired when you're at the hospital. It will make you look terrible and people will be pissed off if you do that, so don't complain about being tired. Do be nice to nurses. Try to learn their names if possible. Knowing who the nurses are makes patient care so much easier. You can just stop by the nurses station and quickly and easily ask for any overnight events or daytime updates when you're in the area. And if I had done that more in medical school, I think I would have been much more up to date on what was going on with my patients. So definitely be friendly with the nurses and try and use them as good resources for you. Do call residents by their last name in front of patients. Residents will always introduce themselves to you with their first name, but in any patient care setting, they should be Dr. So-and-so at all times. I've never been specifically told to do this, but I can tell that residents appreciate it because it helps patients trust them more. Do listen to other people's presentations without interrupting. And again, try to write down tasks to do when they get to the plan portion of their presentation. Don't correct people's old lab values if you happen to know the correct one. Correcting other people's presentations makes you look like a gunner and will not be appreciated. The only exception being if it would happen to actually make a difference in the patient's care. So if the creatinine was actually 1.17 and not 1.2, or the sodium was 143 instead of 138, just keep it to yourself. And of course, this goes without saying, but please do act interested and motivated to learn. Treat every rotation as if it was a possible specialty you might be interested in going into. And then one more last thing, do learn to present patients confidently and try suggesting your own plans from early on. I'll go over this more in a future video on presenting patients. Alright, those are my tips for getting honors evaluations in your third year rotations. Again, a lot of doing well in third year comes down to learning the hidden curriculum of the hospital, figuring out the weird hierarchy and where you fit in. The best way to navigate this is to establish expectations early and get feedback frequently so you know you are headed on the correct course. And of course, always keep a positive attitude and be ready to adapt. It is inevitable that you will make some mistakes, but hopefully this video will help you avoid some of the bigger and more common ones that you'll see people making. The optics of doing your rotations is super important, so avoiding these common mistakes will give you a much higher chance at getting great evaluations. Finally, sometimes getting an honors evaluation simply comes down to luck and the team you're on and the people you're with. Don't be too disheartened if you don't get the evaluation you wanted. These evaluations shouldn't be taken as any personal measure of your capability. They're simply a snapshot of someone's perception of you during an extremely limited time. And their evaluation can be swayed by so many things entirely out of your control, like the mood they happen to be in on the day they sit down to write your evaluation. Your goal is to just put in the best possible effort that you can in order to maximize your chance at getting honors. So I hope this was helpful. Here's just going to be a quick summary slide of everything we talked about, and you can find a summary in the text below. And hope to see you in the next video. Thanks for watching.